Hi, everyone. My name is Cheryl Cohen, and I'm with Arthritis Consumer Experts. I'm also a person living with rheumatoid arthritis. I welcome you to Arthritis at Home on Facts Friday, and I could not be happier to be here today bringing a conversation to you that we have had with Dr. Jonathan Hausmann. Let me tell you a little bit about Dr. Hausmann. Dr. Hausmann is a pediatric and adult rheumatologist at Boston Children's Hospital and Beth Israel Deaconess Medical Center with an interest in autoinflammatory diseases, health-related technology, and medical education. Dr. Hausmann has a keen interest in social media for medical education and personal development and is exploring how adolescent patients and parents of children with rheumatic diseases use social media to obtain or share health information, and how physicians have adopted social media for personal and professional use. Very importantly, at the outbreak of COVID-19, which is where we find ourselves today, he and his rheumatology colleagues around the world quickly formed the COVID-19 Global Rheumatology Alliance. Welcome to the program, Dr. Hausmann. Thank you for taking a few minutes of your time to talk to us.
Thank you, Cheryl. It's really my pleasure to be here.
Fantastic. I guess we're going to start in the obvious place. What is the COVID-19 Global Rheumatology Alliance?
Yeah, good question. So about a month ago, a whole bunch of rheumatologists got together on social media trying to see what we could do for our patients, how we could discover how COVID-19 is affecting our patients, whether they're at increased risk of infections, and how we can protect our patients. And it grew pretty naturally online with a whole bunch of rheumatologists from around the world that were interested in answering some of those questions. We gathered, initially it was on Twitter, and then we gathered on Slack, which is a messaging app. And literally hundreds of people from around the world got together to very organically to start this organization. And it's not only rheumatologists, but it's patients, patient representatives, nurses, physical therapists, epidemiologists. It's like runs the whole gamut. Pretty much anybody that had some interested in answering some of these questions was part of it. So it, I sort of found myself in it by happenstance because one of my fellows actually told me about it and said, "Hey, do you know what's going on?" And I had no idea, so I looked a little bit more into it, and here we are today. It's been about a month since the whole enterprise was set up, and it's been amazing what we've done in that short amount of time.
Yeah, I think, well, congratulations, first of all, not only on so quickly recognizing the need to learn and help your patients through this thing, which I think is really what this is rooted in. It's how do we gather as a village and learn from the experiences of people who are being diagnosed and treated with COVID. Can you tell me so you want to learn about patients and their experience. How are you doing that? What's the mechanism?
Right. So there's a couple of the GRA has several initiatives that are trying to answer that question. How patients are affected, and that's the big question that we try to answer with all of our efforts. So the first thing that we set up is a physician registry. So when physicians diagnose patients with COVID, if those patients have an underlying rheumatic disease, we are recording their information on an international registry. And in that way, we're hoping to figure out, whether patients with, rheumatoid arthritis or vasculitis may be at increased or decreased risk of COVID-related complications. A big topic is also about medications. So as I'm sure you've heard, our president has said that one of our medicines, hydroxychloroquine, is a game changer, he called it. with very little data behind it. So we're trying to, put some evidence behind that and see whether that in fact is the case. So the way it works, like I said, if physicians diagnose patients with COVID-19, they're asked a whole bunch of questions about the patient and also about their clinical status. So, did they get admitted to the hospital? Did they get intubated? What treatment was initiated in the hospital? And ultimately how they did. So, so that's, sort of the core machinery of the Alliance. We realize,
Can I
yeah,
ask you very quickly, Dr. Hausmann, so for right now, the patients that physicians have entered into the registry, about how many are there so far? And what's the disease sort of gatherings, or what are the
right.
cohorts within the registry? What do they look like?
Good question. So I believe, it's almost, we're almost up to 400 patients, which is incredible. So those patients, that information is coming literally from all over the world, from physicians, from the US and from Canada and from, South America and Africa and Europe and Asia entering this information. So it's pretty amazing. The breakdown, I think, last I checked, it was pretty typical of what we see in rheumatology. So, I think the largest group was rheumatoid arthritis, but then we had lupus, ankylosing spondylitis, psoriasis. So it looked, pretty much like we would expect.
The other project that you're referring to is describe that for us.
Yeah, so we realized that there were some shortcomings of this physician registry. So the physician registry only addresses patients that have been diagnosed with COVID-19. So every other patient with a rheumatic disease who doesn't have COVID-19 is not part of the registry. Also, only patients that are severe enough to seek medical attention become part of the registry. So it certainly selects for sick patients with COVID infections. And we realize that doesn't represent all of our rheumatology community. Not only that, the fact that it is a physician-driven registry means that some outcomes that may be, important for patients, patient-reported outcomes, also discussing how the pandemic has been affecting their physical and mental health. A lot of other issues, whether their employment has changed because of the pandemic. A lot of those issues we realized was not going to be answered from the physician registry. So we developed a parallel patient registry so that any patient with a rheumatic disease, whether or not they have been diagnosed with COVID, can enroll themselves and tell us a little bit more about their experiences during this pandemic. One of the cool things that we did is that a lot of the survey is parallel to the physician survey. So we ask many of the same questions to patients that the physician registry asks, so that then in the future we can sort of compare those answers and see, how they're different. But certainly we're asking things that are not included in that physician registry.
Well, first of all, as a patient myself, thank you for having that foresight and that initiative. I know you've been working closely with patients on that particular aspect of the Alliance's work. Tell us how that's going. How is the patient survey response going?
Yeah. So I have to say, so the survey was done in collaboration with patients and patient groups. Cheryl, I think I have to thank you for editing our questionnaire multiple times, and many other patient and patient groups really were essential in developing this survey, because we really wanted to answer the questions that were important to patients. So patients, from the beginning, were instrumental in the development of this survey. So not only, and patients and patient groups were essential in disseminating the survey to patient groups throughout the world. So it was really incredible. My expectations have been totally, overblown on this, because last I checked a couple of hours ago, we had almost 9,000 respondents in, a little bit over a week. So we have this huge database of patients with rheumatic diseases from all over the world that are coming and reporting on their experiences during this pandemic. So it's really amazing and wonderful, and is it's been incredible to see.
Yeah, I'm so excited to hear that. Congratulations, and to all of the sponsor organizations of
Yep.
the Alliance. I know everyone is really thrown in and pushed hard and worked around the clock and answered emails at ungodly hours of the night.
Yes.
And it just shows you that, I think this was something a couple of us said, the patients involved said, you'll be surprised at the numbers once this launches. And we all made a little wager, and we'll easily get to 10,000. I think you thought we
I
were
think so.
smoking dope or something. But truthfully, it's about, I really think it resonates in patients, and because we're, a lot of us who have not been diagnosed with COVID but want to help. And I think that's the beauty of the survey, is that you're going to learn, we're all going to learn about maybe some of the things that those of us who didn't develop COVID, what did we do to
Yes.
avoid that outcome?
Yep.
I mean, I think so. I mean, hopefully in our lifetime, this will be the only pandemic we live through. But we have an obligation, I think, to gather this knowledge and share it with, our children and their children in the future. So that's tremendous. So where can physicians go to register patients,
Yep.
and where can patients go to take the survey?
Yeah. So we have a a wonderful website with all that information, and you can get to the website. It's rheum-covid.org. So rheum as in rheumatology, RHEUM dash COVID, COVID.org. When you get to the website, you'll find out more about the GRA, and right in front, you'll see two buttons. The first one, I believe, is for physicians. So if you're a physician who's evaluating a patient with a rheumatic disease diagnosed with COVID, click on the first button. And if you're a patient with a rheumatic disease, whether or not you've been diagnosed with COVID, you click the second button. It'll tell you more about our study. The study is entirely anonymous, so we don't collect any personal information. The study was approved by the Institutional Review Board. So there's some oversight to make sure that the questions we ask are adequate. And certainly, like you said, the reason to do the studies, because we want to publish these findings as quickly as possible to help either people prevent getting COVID infections, or learn what are the things that people are doing once they get infected to try to optimize outcomes. So these are two very, very important questions that we want to try to answer with our data. And hopefully, the point of the Alliance, we got together very quickly, and we want to put out the data as quickly as possible. So, over the next couple of weeks, we're going to be analyzing that data and at least having some answers, hopefully, in a couple of weeks.
Well, that is incredibly exciting. I can't wait to read those reports for sure.
Me neither.
Yeah, I know. And we hope that you may be willing to carve out another 10 or 15 minutes when you do get ready to make that information public, so that you can give us some of your insights into the data that's been collected.
That's a deal.
Okay, perfect. I like that. I drive a hard bargain. Dr. Hausmann, thank you so much for joining us at Arthritis at Home on Facts Friday. We really appreciate your time. We cannot thank you and your colleagues around the world and all of the patients who are involved in this initiative to build our village and make it work for people.
Sure, no, It's really my pleasure, and you know, I have to thank all the people from the GRA that have worked on this, and all the patients and patient organizations, including you, Cheryl, and many other people that sort of were involved in making the survey and in disseminating, because it's really been a team effort. But thank you.
Terrific. Terrific. Thank you so much. And thank you everyone for tuning in. We look forward to seeing you again on Motivation Monday. Take care and be safe.
Bye.